Welcome to this brief educational video about urinary incontinence, produced for Always Discreet by the Gynae Geek, aka Dr. Anita Mitra. I think it's important to start with some brief anatomy. So this is the female pelvis side on, and at the back we have the coccyx, or the tailbone, the rectum, which is where the stool empties from the bowel, and in front of that we have the uterus, or the womb, and that's continuous with the vagina. And at the very front we have the bladder, which is where the urine will sit, and it empties through a tube called the urethra. The urethra, vagina and rectum all pass through the pelvic floor, which is a sling of muscle and connective tissue that supports all the organs, keeping everything inside. Now we're looking at the bladder from the front, and there are two kidneys that produce urine, and this drains into the bladder via the ureters. The bladder has two sphincters, the internal sphincter and the external sphincter, and both of these need to relax in order for the bladder to empty. The external sphincter requires relaxation of the pelvic floor muscle in order for the sphincter to open and for urine to flow out. The definition of urinary incontinence is uncontrolled leakage of urine from the bladder, and this can be anything from a few drops to several hundred mils. I'm now going to talk to you about the most common types of urinary incontinence, and the first one is stress incontinence. Stress incontinence is the leakage of urine when there is additional pressure on the bladder, and this can occur with everyday activities such as coughing, sneezing, exercising, and also during pregnancy. During these times of added pressure, the pelvic floor muscles help to keep urine inside the bladder, so having a weakened pelvic floor makes you more likely to have stress incontinence when you do these kinds of activities. That's why pelvic floor muscle exercises can be a really effective treatment for stress incontinence. The next most common form of incontinence is urge incontinence. This happens when you get a sudden, urgent desire to go to the toilet to empty your bladder when it's not the right time to go to the toilet and you may not have a full bladder. It happens due to inappropriate contraction of the bladder muscle itself. Whilst pelvic floor weakness is not a cause of this kind of incontinence, having a strong pelvic floor can help you to stop leaking urine at these times of urgency. Medications, as well as minor surgical procedures, can be very helpful for urge incontinence. If you have the symptoms of both stress and urge incontinence together, this is called mixed incontinence. Please do remember that you should not feel afraid or embarrassed to go and speak to your doctor about any kind of urine leakage. This is the best way to make sure that you get the right treatment available for you because help is available.